I retired 10 years ago at 39. And out of everything that people ask me, this is by far the question that I get asked the most. But what about health insurance before 65? 10 years later, I'm still nowhere close to 65. Medicare isn't even on my radar, like at all. And right now, my health insurance costs me $0 a month. And look, I get why you might have just fallen out of your chair. I mean, for most folks thinking about retiring early, health insurance is the thing that kills the whole idea before it even gets off the ground. If you're 40, 50, 55, Medicare is still like up to 20 years away. And one bad hospital stay could wipe out years of savings. Easy. I had that fear before I ever quit my job. And no, I didn't retire with some giant pile of money where I could just shrug off a huge medical bill. So how am I actually pulling this off? Well, before I get to that, real quick, I just want to thank each and every one of you who watch these videos and support the channel. You watching is what keeps me motivated to make them. So thank you. Okay, before the comments go where they always go, let me just explain what actually happened. I live in Indiana and I'm on expanded Medicaid, which is part of Obamacare. Now, this isn't to be confused with traditional Medicaid, which is what most people typically think of. Here in Indiana, it's called the Healthy Indiana Plan, or HIP. But here's the thing, that was never my plan. When I first retired, I fully expected to just buy a Marketplace plan, like an ACA plan. That was my assumption walking in. So I did what everybody does. I went to marketplace.gov, filled out the application, put in my real income after I left my job, and I fully expected to compare bronze plans versus silver plans. But instead, the system came back and it basically said, nope, you're not even eligible for a Marketplace plan. At first I thought, well, maybe I entered something wrong, but I hadn't. Based on my income and Indiana's rules, it just routed me straight onto Medicaid. I remember sitting there thinking, that's not what I expected. I mean, I thought Medicaid was for old or disabled people or something. I mean, I didn't sit down at 39 thinking, great, I'll retire and go on Medicaid. I just filled it out honestly, and that's where my numbers landed me. And here's the part that trips people up the most. Expanded Medicaid isn't looking at what you have. It's only looking at what you make. No asset test. So it doesn't matter that I've got a portfolio sitting there. It doesn't check my brokerage account, doesn't care about the house, none of that. It's just income, plain and simple. And that's true in 41 states right now, not just Indiana. See, a lot of people assume that there's an asset limit, like there is with regular Medicaid for older folks or long-term care. There isn't, not for this. It's purely, well, what did you make this year? So the obvious question is, well, how's my income even low enough for that? And this is the part that people usually struggle with. My wife and I, we spend around $24,000 a year. And I know people hear that and they think, well, we must be miserable, like counting every penny. We're not though. We just figured out what we actually care about spending money on, and we cut out the rest. Honestly, that's the whole foundation of this. You don't spend much, you don't have to earn much. Now look, I still make money from an online affiliate marketing business that I run, and now a few dollars from this channel, but a good chunk of that goes straight into my solo 401k, tax deferred. If you have a regular job, you probably have a 401k through work. Since I'm self-employed, a solo 401k, it's the same thing. It's just that I had to do all the paperwork to set it up. If you have an employer, they do all that for you. Now, I'm not going to turn this into a whole lecture about taxes because I'm certainly no expert. But the short version is, self-employed people can usually put away more into their solo 401k than you might think. It lets me keep saving for later, and at the same time, keeps my taxable income, my MAGI, very low. It's not some hack, it's not a loophole. And every time I bring this up in a video, I get people saying that I'm gaming the system and that I should go back to work, that I'm taking something from people who actually need it. And I used to get kind of defensive about that, I'm not gonna lie. But I don't really anymore, because nothing about this is illegal or immoral. Here's how I see it. I didn't hide anything. I didn't make up numbers. I didn't lie on the application. I put in my actual income every year, and the state tells me what I'm qualified for. And look, nobody thinks that you're gaming the system when you take the standard deduction or you contribute to a 401k to lower your tax bill. It's the same idea here. The rules exist, I qualify under them, and using what you're legally entitled to isn't a scandal. It's just how the system is built to work. Now, if you think the rule itself is a bad rule, okay, fair. I actually get that. But that's an argument that you take up with people that write the rules, not with someone who's just following them. You can think that the system is wrong without thinking that the person inside it is doing something wrong. Okay, so is the coverage even any good? Well, I pay $0 a month. There used to be a tiny copay, like $5 or $10, but that got dropped during COVID and it just never came back. And whenever I've needed a doctor here in Indiana, I haven't had any trouble finding one. All the bigger networks around here take it. Now, dental, that's the one part that's gotten a little bit annoying, honestly. It used to be pretty good, but for whatever reason, this year, it's gotten harder to find dentists that still take DentaQuest, which is what runs the dental side of it. So here's what I end up doing instead. If you're a regular on this channel, you know that we already spend a part of the winter in Asia anyway. So to the last trip, I got a cleaning in Vietnam for $11, x-rays included. And honestly, just as good as anything that I've gotten over here. And a friend of mine who now lives in Vietnam, he got an implant done over there for around $700. Here in the States, that's easily $4,000, if not more. Now, that doesn't mean that Vietnam replaces having insurance. It just means, hey, if we're already gonna be there, well, dental's something that I can knock out without it costing me a small fortune. Now, as you've likely heard, expanded Medicaid is adding work requirements starting in 2027. Roughly 80 hours a month through work or training or community stuff. For me, that's not really an issue because between this channel and my marketing business, I'm already way past that. So it's not like I'm scrambling to find some workaround. Yeah, the rules are changing and I'll just follow the new ones, same as everybody else has to. And look, if they change again after that, I honestly don't know exactly what this looks like in 5 or 10 years. I mean, nobody really does. But see, I've always known that this setup could change at any time. Medicaid works for me right now, but it's not the only plan that I've got for the next 16 years. Worst case, I pick up part-time work that comes with benefits, or we just spend more time overseas, or I go buy a marketplace plan outright. There's more than one option here. My wife, for what it's worth, is actually on a marketplace plan right now while she finishes up her citizenship stuff. And it's about $100 a month after subsidies with a $750 out-of-pocket max. She's not on Medicaid, and that's fine. It just shows that people in the same household don't even need to have the same setup, which I think kind of surprises a lot of people when I bring it up. The point being, each situation is different. And if you're trying to figure out health insurance before 65 for yourself, I'd look at it roughly in this order. First, a spouse's employer plan, if it's actually affordable and the coverage is decent. Then COBRA, but just as a short bridge right before leaving a job, not something that you build 10 years around. Then an ACA Marketplace plan, which is honestly where most self-employed or early retired people end up. Then Medicaid, but only if your actual income and your state's rules put you there. And then private coverage outside of the marketplace, like if you need a specific network, though you'll lose the subsidy help there. Lastly, consider what your life and your options could be if you consider moving abroad, even if just for a few years. Anyway, if you're into this kind of stuff, go ahead and subscribe. A lot of other retirement channels are from financial planners, not people like me actually living it. When I was thinking about retiring at 39, just like you, health insurance was one of the things that scared me the most, and it should have. But it turned out that it really wasn't a wall. It was more like a problem that I just had to sit down and actually understand. My answer, at least for now, ended up being expanded Medicaid. Yours might look totally different, and that's okay. If you take one thing from all this, learn your MAGI. Learn how it works, what pushes it up, what brings it down, and what it actually means where you live. Don't just assume that you've got to wait till 65 to retire because Medicare feels so far off. Look, I don't know what this looks like in 10 years. I really don't. But I do know that I've got options. And if the rules change, I'll just deal with it when they do. And that's kind of what early retirement's been for me, honestly. Not having every single answer lined up ahead of time. Just having enough room to figure it out when something comes up. And if you're wondering how my actual withdrawal rate held up this whole time, through COVID, through inflation, all of it, without ever changing, I get into that in another video. I also talk about why I never really had an identity crisis after quitting, which a lot of retirees really struggle with. I'll leave a link down below. Go watch it next. Thanks for watching, my friends. I'll see you next time.